Siddhi Raigandi, a third-year medical student from Janelta Foundation School of Medicine. Today we are here to perform a breast examination video. For the video, there are some clips in which there is breast examination shown, but we have used a dummy. Examination of the breast initially requires the full exposure of the chest, but later in examination, when you start palpation, cover one breast when you are examining the other. A thorough examination of the breast in inspection includes skin changes, symmetry, contours, and retraction. This can be done with the 4 views, keeping in the mind. Why 4 views? Because sometimes the dimpling is invisible when patient is just sitting or standing. The 4 views are as follows. Ask the patient to keep the arms at the sides, keep the arms over the head, arms pressed against the hips, and leaning forward. Note, in this we have to ask the patient to remove the gown and inspect the chest. While palpating, ask the patient to lie on his or her back in supine position because this is the best way to perform and flatten the breast tissues. Now, you have to not open both the breast at a time. So, using your second, third and fourth finger pads, press gently, medium and deep pressure and in small circular patches so that you can find a lump very easily. Now, while applying deeper pressure, do not confuse yourself with the normal rib with a hard lump mass. Ask the patient to roll onto the opposite hip, placing her hand on her forehead but keeping the shoulders pressed against the bed to examine the lateral portion of the breast. This flattens the lateral breast tissue. Palpate in a vertical strip up to the chest to the clavicle and overlap until you reach the nipple. Then reposition the patient to flatten the medial portion of the breast. To examine medial portion of the breast, ask the patient to lie with her shoulders flat against the bed and placing her hand at the neck and uplifting her elbow until it is even with the shoulder. Palpate in a straight line down from the nipple to the bra line and then back to the clavicle. Continue in vertical overlapping strips to the mid-sternum. While palpating, examine the consistency of the tissues, tenderness if any, and if you find any nodules, note the characteristics, its location. So, how will you describe the location? If it is in the upper outer quadrant, say that it is upper outer quadrant. If it's present here, you should say upper inner quadrant. Then, after that, the size, the shape. It's round, it is disc-like or irregular. Then, its consistency, which is soft, hard, firm. Moving towards the nipple, palpate it and note its elasticity. Ask the patient if he or she has any prior discharge from the nipple so that you can press the areola gently with your index finger and thumb and see if there is any discharge present. Moving towards axilla, axilla can be examined in sitting position or lying position also, but sitting is preferable. While examining, you have to use your opposite hand when it is left or vice versa. While examining, ask the patient to keep the hands at her side and then use your right hand and then start palpating the axilla. Tell the patient that it will be a little discomfort for her. Now while palpating, move your hand towards the axilla deep into it and you can palpate the central nodes.